Horizontal cleavage meniscus tear, the quad tendon augmentation technique. The horizontal cleavage tear is identified and inspected to determine that the leaves of the tear are adequate for repair. The avascular non-repairable central rim and frayed inner portions need to be removed using an arthroscopic meniscus biter and mechanical shaver. In most cases, a tissue bubble could be seen in the meniscal ramp area when placing the shaver between the upper and lower leaves. This shows a complete extension of the tear through the meniscus wall and some tissue laxity that need to be addressed. A quadriceps tendon graft of 20 mm length and 10 mm width is harvested, and two high-strength sutures on each end and circumferential compression stitches are placed all over the graft. The graft is inserted through the anteromedial portal using a kingfisher grasper and placed in position inside the horizontal cleavage tear. Care should be taken to avoid iatrogenic cartilage injuries of the tibial plateau and femoral condyle. Through a trans-notch view, it can be seen how the bubble has disappeared. The tissue at the posterior ramp is tighter and the height of the meniscus is restored. First, vertical sutures were made using fast-fix anchors in the most lateral side of the medial meniscus posterior horn to approximate and compress both the femoral and tibial surfaces of the torn meniscus and stabilize the graft. Once the graft is secure, the traction sutures are cut and the graft remnant is trimmed. The fast-fix needle is inserted first into the superior leaf of the tear, and the second anchor is placed across the horizontal cleavage tear inside the depth of the inferior leaf. The stitches are made between 5 to 10 mm intervals to have the effect of a vertical mattress suture. In the most medial part of the tear, where the posterior horn is in continuity with the meniscal body, it is preferred to use an outside-in suture with the two spinal needles technique. At the end of the procedure, the stability and tightness of the repair is tested with a probe, as well as repetitive flexion-extension movements.